It's my formulas, yet the computer does a better job.
Could you explain what happens for the layperson inside the body that causes them to go into remission, or to their body's ability to be stimulated enough to help them fight the cancer?
Well, we'll back off one little bit. What are we hoping to achieve? Number one, to stop the growth of the cancer. And it's an odd little bit, and it may sound silly. If you live long enough, you may live. If you live with the cancer long enough, eventually the body will do it. It's dependent. You can get different immune responses. In other words, you get a standoff. They continue, your cancer is live, and you make tumor cells all the time. It multiplies. If the killing rate equals that, you will then stand still. You'll have the cancer, health should come back, and you're standing still. Another way is the tumor dies, and the body, with another immune response, wraps it with fibers. Essentially, fibroblasts are in connective tissue, walls it off. And the best way is for a total regression of the tumor. You can have all of those responses. How does this occur? It's theoretic. I don't know. I think the tumor antibody goes to the tumor. The tumor complement activates the antibody. The product is a dead cell. When the cell ruptures, it liberates the prealbumin, the blocking protein, which will stop further activation of the antibody. Now, in an individual that has a small tumor, there are many patients that after you do an autopsy on them, and you open them up and you find dead tumor all over the place, yet they were never treated, which means there is an immune mechanism. We're adding it to make it more efficient. You can't totally unblock it. If you unblock it, you have rampant killing of tumor cells. Now the liver then starts to work hard, and you go into liver exhaustion. We had 2 patients who went into liver exhaustion with dire results in '77. So an anachronism is we treat very vigorously, cautiously.
Dr. Burton, how many total patients have you treated?
The best I can tell you is how many patients that have come here. Approximately 3,600, which includes maybe, I would say, a good 2,000 that have come here. We rejected the patient, but they've been examined, they've gone into the computer. We never treated them. So I would say on a whole about 3,400 patients.
What percentage have been terminal?
Well, one of the reasons we came here was to treat patients. Hopefully we would get patients before their immune mechanism have been battered. And in 1977, 12.4% were pristine cases. In 1987, we graduated to 1.4%. We have gone the other way. It's called the last chance saloon.
So almost 99% of the people coming here are terminal.
Are all in the terminal
What
state.
do you think, or what is your experience as far as chemotherapy affecting their chances of survival?
Well, we'll pick a type of case, pancreas to liver. When we get them pristine and the surgeon has done their job, almost all of the pancreatics jump and get liver metastasis. So when they biopsy them, they should do a bypass so that they bypass the common bile duct. If they do this, we have many that are alive and doing very well.
What are the most serious forms of cancer that normally would have no prognosis of surviving that you've been able to have good results with?
Well, the one I think, and I haven't seen a report, we have the only, quote, cures, that's 5 years from diagnosis, for peritoneal mesothelioma. We have, let's see, Jerry Lampe is 8 years out of New York. Hovhanessian will be 8 years this coming December. Mildred Irwin has passed 5 years. There's a whole group of them. I think we have 8 or 9 of those alive out of approximately 20.
So you have about 20% survival rate.
Of this kind, we have almost 50%.
50% now of the most
Of the
worst,
deadly, the worst CA.
worst types of cancer.
Well, the NCI put out a booklet on this one, and on page 5 on mesothelioma, it says for the peritoneal mesothelioma, there is no treatment, only palliative treatment for pain.
And yet you have some of these alive and well.
Well, there's 1, 2, the first 2 do not take any treatment at home. In fact, I haven't seen Jerry Lampe since 1984. The only thing he suffers from is overweight, which is in contrast to the wasting part. Yes, patients gain weight. I've often wondered why. Well, part of it is, I think, is psychological. How do you celebrate when you get better? You eat. When you eat, you feel better. What do? You eat again. And some of them gain weight. But this is the worst type. In terms of colon to liver or metastatic colon, well, quote Dr. DeVita, nobody makes 5 years. And yet we have a whole group of them. The first 2 patients, well, the first patient asked me, how long could I live? Well, as Robert Beasley, we treated back in New York in 1975, colon to liver, jaundice. Robert Beasley is still alive. He hasn't taken any treatment since 81.
And yet that normally is a totally terminal cancer.
They all die then tobacco. Well, it's a miracle. There's Dorothy Strait, August of 76. And it's colon to liver, cannonballs in there. In fact, this one is verified by her doctor out of Virginia Beach. He should have hooked her back up together.
Why don't you do this? Hold your thoughts. We're at the end of our particular broadcast today. However, we're going to take advantage of Dr. Lawrence Burton's starting to unwind and talk about his therapy. We have a lot of his patients. We also want to take you through his clinic so you can see firsthand what goes on. It's amazing that one of his critics claimed that Dr. Lawrence Burton's clinic should be closed because it was a filthy, fly-infested rat trap with no sterilizing equipment and a breeding grounds for AIDS and other conditions. Well, needless to say, that kind of statement, irresponsibly stated, could scare people away, people who had inoperable cancers, the very type of cancers that the National Cancer Institute claims cannot be helped. And yet here, Dr. Burton, according to the evidence that I have seen and the patients I've interviewed, has been able to help as much as 50% of otherwise untreatable, terminally ill people. So stay with us, come back next week when you'll have part 2 of an ongoing odyssey, a profound medical courage, Dr. Lawrence Burton. I'm Gary Null from Freeport, Grand Bahamas. Stay healthy and stay well.